first question that I'll put to each of you is, and you've kind of touched on it, but when you think about your organizations and the people that are touched by your organizations, what technologies or work processes have you or your companies adopted that you never tried before? And I'll put it to you first, Shelley.
The most obvious one is moving the entire news operation remote. I think that's one of those things we didn't think to do that before, right? You have a news studio, and in the weather department, there's millions of dollars of technology and computing gear and graphics software programs and all of that. And I think if you had told us, okay, in a year, you're going to do the weather from home, it would have probably taken us a year to figure out how to do it. Instead, you have a week to figure this out. And we sent one of our meteorologists home, who is very tech savvy, Kat Campbell, and said, hey, figure it out. Tell us what you need. And she came back with a very prosumer solution to doing the weather at home. And I think the first night she did it, had she not been on Twitter saying she was doing it from home the first time, I'm not sure the audience would have really known. And she's using very prosumer gear. She has an Apple TV device that she's throwing her screen to so that she has a confidence monitor. And there's all kinds of little things. She hung a green sheet in her kitchen, attached to the floor with 2 soup cans. And in the news studio, that's a massive, huge green wall, and it's the technology of putting a person in front of the graphics. And so I think that notion of we can do the weather, which is one of the technologically most advanced things we do in a remote way, was a big aha, that if we can do that, then we can do the rest of it. And it sort of blossomed from there. Some of what we're doing in my unit with virtual homeschooling and trying to figure out how do we help bridge that gap between what the students need and what the parents need, because now we have a whole group of parents who are working and educating their kids all at the same time. And we can talk a little bit more about that product later, but that was sort of another one in how might we, and asking that question, how might we do this? And it forces you to think about it a little bit differently.
It's an excellent story, and I don't think people you start to realize that when you're really pushed into a corner like that, almost, there's not time for a ton of discussions. Like you said, it's the innovation comes out of, okay, we don't have a lot of time here. Let's figure it out.
You really don't have time to overthink it either, and I think that's a good thing. I think innovation can happen really fast, and this crisis has proven just what you said a minute ago. Innovation is the mother of invention or necessity, right? Just the whole idea of, we don't have time to figure this out. You've got a week. You go away and figure out how to do it. The rest of the meteorologists are going to go on TV like we always do. But as we begin to separate people, we're going to have to solve it. And that early success kind of helped us scale out the rest of our operations.
That's exciting, and that's part of, having you guys on today to tell stories. Hopefully that motivates other people to start thinking that way. So, or inspires them. What about you, Mr. Snyder?
So I agree with what Shelley said in terms of behaviors and what we see. I think it's interesting when you think about any new technology that comes out. Generally, there are these early adopters, is the term that's given to the people that, like, the first day that something new comes out, they want it, they want to play with it. But really, most of the market comes much later. And, they're kind of late adopters. And then eventually you work all the way to the end where you have these laggards that, just don't want to change. And the fact is, change is really, really hard. But what COVID-19 has done is it's forced us to change. And I think in many cases, we're not really actually doing things that are that new from a technology point of view. We've had the ability to work remote. We've had the ability to do video calls and things, but only the early adopters were really doing it with any kind of regularity or success. And it's forced that adoption curve to change really dramatically and go into fast forward. And I think what people are quickly finding is wow, these actually work. We can get things done. We can do things. And so what's really interesting about that, I think, is that there's a lot of discussion about when are we going to go back to normal. We're really not going to. There are certainly things that will be more familiar again as we aren't all quarantined in our homes, but the way we use these technologies, I think largely is going to stick, and it's going to fundamentally change the market. And those that understand how to take what we're learning very quickly now and start to make it part of our day-to-day practice, I think are going to be the ones that are successful.
Yeah, absolutely agree. Well said. Josh, how about from the Cisco side of things?
So I'll layer on. Tom gave kind of a great segue there because, business as usual, it's a lot of that is going to be what we're doing today. A quick example of, me trying to be the teacher now with my 8-year-old daughter, trying to multitask between working and, also making sure she's following the directions. That's one thing. I hope to God that goes back to quote unquote normal where, she goes to school again. But, rearranging and, maybe getting out of our comfort zone, a lot of my meetings where I'm customer facing, I do in the afternoons. So I can do things in the morning with like e-learning and kind of what we're doing with the school systems. And WebEx and video has been a really interesting, the adoption curve has been exponential, right? Because being forced to do this has really changed a lot of that. And I thought it was really interesting. A couple of weeks ago, Chuck Robbins, our CEO, came out and gave some statistics about WebEx that I thought were really interesting. I wanted to share. So just to give you a baseline, in January, globally, we had 153 million WebEx attendees for that month. During March, when the shutdown kind of began, in a 24-hour period, we saw 240,000 new WebEx accounts registered. And April the April numbers haven't hit yet, but in March, we did 4.2 million meetings per day, which is, just mind-blowing when you think about that. But these are the kinds of things. I was on a call earlier today where there was a manufacturing customer that was telling us a lot of times he'll drive out and do some break fix, repairs for a large manufacturer. And he was saying that what normally takes 2 hours has actually turned into a 20-minute service call now because they've learned to use the technology and adapt it, and it's actually going to change the way that their future business looks. So I think we're going to see a lot of really exciting kind of innovation and true adoption on the backside of this.
I totally agree, and I know one thing that was announced early on that Cisco did was they, correct me if I'm wrong, but wasn't there like a 90-day free access to WebEx, the WebEx platform in the very beginning of this, just to give people a way to communicate, a way to connect?
Yeah, exactly. And there's actually a number of different offerings now. What we've done is WebEx was the first because we had to come out, and so what we're doing now is we're giving away just free WebEx licenses to get people connected, to kind of get them over the hump. But then we're also doing the same thing throughout our security portfolio. So Umbrella is the open DNS platform that we bought. So being able to ping that DNS server and not have to route that traffic back through an enterprise firewall. But then also doing some other things like, we're doing some in healthcare, for instance, kind of a network in a box where we're giving a cellular connected router with an access point and a video endpoint. So they can unbox these things, plug them in, they call home, and then they can have remote connectivity out to these, these disparate areas where we may not have had the opportunity to have telemedicine. And so we're doing a couple of things like that to try to, put plug some holes for our customer set.
That's awesome. And again, awesome stories. I mean, things like this is what I think really inspire people and make people realize, you know what, there's going to be the other side. We're going to get to the other side. And in the process, we're going to learn a lot of things.